Hello.
Hi, my name is Hermine Tsaturyan. I'm going to be your family nurse practitioner today. Before we get started, I just like to let you know that this session is being recorded for educational purposes, and it will be uploaded to YouTube as unlisted for um, the instructor to grade and review. Do you consent for it to be uploaded to YouTube and recorded?
Yeah, that's fine.
Can I start off with you stating your full name, age, and date of birth, please?
Hermine Tsaturyan, June 27, 1997, 25 years old.
And what brings you in today to our clinic?
Just in the wellness checkup for work.
For work, okay. And what was your last wellness checkup?
I think it was about 2 years ago. I don't remember exactly. Sometime during COVID.
Any reason why you haven't gotten a wellness checkup within the last year?
Yeah, I've been busy with work and I was trying to avoid unnecessary contact at the hospital or at a clinic.
And what was your most recent lab work and how were the results?
I don't recall. I think it was about 2 years ago. I would have to take a look. I think everything was normal.
Perfect. And do you have a copy that we could take a look at later?
I think I had to go through the portal to get that access, but yeah, once I find it, I could submit it to you guys.
Perfect, thank you. And have you had any childhood illnesses such as measles, mumps, rubella, chickenpox, whooping cough?
I think I had chickenpox when I was younger, but that's about it.
And have you received your childhood vaccination?
I believe so, yeah.
And any other vaccinations that you have received? Do you remember when you received them?
I know I'm completed with the COVID vaccinations, 3 vaccines. I need to get the updated flu shot for
And
this year.
which COVID vaccine did you receive? Do you remember?
I believe it was Moderna for all 3.
All 3 of them?
Yeah.
Okay, perfect. And have you ever been diagnosed with any medical problems?
As a medical problems, no.
How about any psychiatric illnesses?
No psychiatric case.
Have you had any recent hospitalizations?
No. Not hospitalization.
And have you ever had any surgeries?
I did have a surgery for my nose to get a symptom,
Okay.
but that's about
Do you
it.
recall when that was?
2017.
And did you have any complications with your surgery?
No, I breathe perfectly fine now.
And are you taking any medications, whether they're prescribed, over the counter, or like herbal supplements?
I do take Tylenol or ibuprofen once in a while. And I take protein supplement because I work out.
What do you take Tylenol or ibuprofen for?
Just for headaches mainly.
How often do you get those headaches? Is it frequent?
Like twice a month maybe. Sometimes I'm just too busy with work.
So that's what triggers the headaches?
Yeah.
Okay. And do you have any allergies to food, medications, or environmental factors such as pollen or like certain chemicals, rubber, latex?
I don't believe so. I don't think I'm allergic to any of those stuff. But yeah, I haven't noticed anything.
And how many hours of sleep do you get throughout the night?
I get like 5 hours of sleep.
Only 5 hours? And
Yeah.
with that 5 hours, do you feel rested after you wake up?
Sometimes depends if I have coffee in the morning or not.
So coffee helps
Yeah.
you. Okay. And do you take naps during the day?
Not usually, no.
Okay. And what's the reason you sleep so little? Is it
just
stress? Is there anything that's bothering you?
I just work long hours, so I tend to stay up just so I have some time for me to do stuff that I like. also work out, so I go to the gym late.
Okay.
So yeah.
As you mentioned that you work out, how many times a week do you exercise?
I'll say like 4 or 5 times a week.
And what kind of exercises do you do and for how long?
I do jiu-jitsu for 2 days a week, for like 2 hours. It's pretty heavy on cardio, and then I do weights on the other 3 days.
Okay, perfect. And what does your general diet consist of? What do you like to eat?
Honestly, I eat a lot of Mediterranean food. I just eat whatever I like. Not too heavy on the vegetables. Meat, I do consume all sorts of meat. But I'm pretty active, so.
Makes sense. And do you recall what you've consumed within the last 24 hours?
I had tea and eggs in the morning. For lunch, I ate soup. I think that's about it for today.
Okay. And do you drink coffee or tea or any energy
Yeah, I do
drinks?
drink both of those.
How many of each would you say you consume and how often?
I do drink black coffee. I don't like the sweetener. Maybe like 3 cups a day and maybe 2 cups of tea.
Okay, perfect. And how much alcohol do you consume?
Just occasion, not even on every occasion. It might not even be every month, maybe every other month, if so.
Do you recall when your last drink was?
I'll say it was New Year's Day.
New Year's Day.
Yeah. I had quite a bit of drinks that night,
Okay.
like 5 shots.
Okay. And do you use any tobacco products, whether they are e-cigarettes, actual cigarettes?
No, I don't smoke anything.
You don't smoke anything?
No.
And have you ever used any other recreational drugs?
No.
No.
Not at all.
Okay. And what is your race and ethnic background?
I'm Caucasian and I'm Armenian.
And have you been living in the United States your whole life?
I've been living here for about 17, 18 years now, and this year. I was born in Armenia and moved here when I was 7.
Okay. What is your marital status?
I am single. I was in a relationship last year for about 6 months, and it ended around November, like towards the end of November.
And do you have any children?
No children at the time.
And are you currently sexually active?
Yes.
And do you use protection?
Yes.
What kind of protection do you use?
Condoms.
And when was your last testicular exam?
I think it was about 2 years ago, if I recall correctly. Yeah.
And do you perform self-testicular examination?
Yeah, I do try to do it once a month in the shower, as I was taught.
Okay, and what is your current occupation?
I'm a registered nurse. I do home health, hospice. I visit like home setting and assisted living, but also clinical setting, just providing that end of life care.
And how long have you been doing that for?
About 2 years.
2 years?
Yeah.
Okay, very nice. And do you live in a house or an apartment?
I live in a house at the moment.
Who do you live with?
I live with my parents, also my sister.
Okay, and what is your current address?
123 Pine Tree.
And does your house have a pool? Does it have gates around it if you have a pool?
We do have a pool, but it used to be gated, but not anymore. 'Cause there's no more children coming around, so we felt like we didn't need the gates anymore.
And do you know how to swim?
Yeah.
Do you feel safe around water?
Yeah.
You do, okay. And do you feel safe at home? Do your family members treat you well?
Yeah, we are a close-knit family. Our culture is mainly focused on families, so well supported by everybody.
And do you feel financially stable?
Yeah, I have a good paying job, and my parents are there to support me in case I need anything, in case of emergency. But I tend to be financially independent.
And would you say it's difficult for you to afford your basic needs, or
No, it's pretty easy, except with the current prices.
and do you drive a car or do you use public transportation for?
I drive a car.
You drive a car, and do you use a seatbelt when you drive your car?
Yes, of
You
course.
do. And do you have any guns in your house?
No guns.
Now I'm going to be asking you some questions about your family health history, if that's okay. You said
That's
you
fine.
live with your mom and your father and your sister. Can you give me some information about them, how old they are, and if they have any medical
Sure.
conditions?
My mom is 48 years old. My dad is 55. Both of them, they drink occasionally. Nothing major medical history wise. Just occasional Tylenol here and there for headaches. My dad does smoke, but other than that, relatively healthy. My sister is 28, relatively happy. She works out. She works out. Overall, everybody's pretty healthy. Nothing concerning history-wise.
And now I'm going to be asking you some questions about your maternal and paternal grandparents. Can you tell me some information about their medical history? Are they alive? Are they have they passed away?
My maternal side, they passed away before I was born, so I don't know too much. My paternal, they both had high blood pressure, but otherwise they're relatively healthy. Um, Neither of them smoked, just occasional drinking.
And are they all alive?
No, they actually passed away.
And how old were they when they passed? Do you remember?
My maternal, I'm not sure. My paternal, around 80.
Around 80. Now I'm going to be asking you some questions for your physical health, if you don't mind, if that's okay with you.
Sure.
To start off with your skin, have you had any itchiness or have you noticed any rashes on your skin?
Not that I noticed, no.
Okay. And have you had any head injuries? You told me you practice jiu-jitsu. I know that's very physical.
No, nothing of the sort.
And do you experience headaches? If so, how often?
Maybe twice a month, if that.
Twice a month, if that. Okay. And do you wear glasses or do you wear contacts?
No. Perfect vision.
When was your last eye exam?
It's been a couple years. Maybe even 5 years.
5 years, okay. And have you noticed a change in your hearing?
No, I hear fine.
Do you feel dizzy ever, or have you noticed any ringing in your ears?
No ear pain or dizziness or ringing in the ear, that sort, nothing like that.
And have you noticed any nose stuffiness or bleeding?
No.
And you told me that you don't have any allergies, but have you ever experienced any hives or hay fever, any asthma attacks?
Nothing of that sort, no.
And have you noticed any bleeding in your gums?
Maybe when I brush a little too hard, but otherwise, no.
How about, do you get sore throats?
Can't remember the last time. Might have been a year ago, if that.
And have you noticed any stiffness or any lumps in your neck?
No, just during practice, maybe you kind of warm up. You'll be a little sore for a day, but otherwise, no stiffness, nothing like that.
And do you ever feel short of breath, or do you feel like you ever have heart palpitations, maybe when you're exercising?
No, nothing of that sort. Nothing to that extreme where I feel out of breath and having palpitations or chest pain.
And have you noticed any like swelling in your arms or legs?
Um, Maybe about 2 years ago, like when I first started, I sprained my foot in practice, but otherwise it's been good.
Okay, very good. And have you noticed a change in your appetite, like excessive weight gain, weight loss?
No, my appetite is pretty good.
No extreme weight gain or weight loss?
No, I've been pretty steady on my way.
And do you ever experience diarrhea or constipation?
No, pretty regular, pretty normal bowels.
Do you go on a daily basis, would you say?
Yeah, for the most part.
For the most part. And do you ever experience difficulty urinating?
No difficulty urinating.
Have you ever noticed like blood in your urine?
No, I don't think so.
Have you noticed like any leg cramps?
Only when I do leg day at the gym, but otherwise, no.
Nothing. How about like clots in your veins?
No.
Okay.
No aching or anything of that sort.
Have you noticed like any muscle pain?
Nothing more than like what I get from like exercising, but it goes away in like a day.
How about like have you ever broken a bone?
No.
No. Okay. And have you ever lost consciousness or felt like fatigued, fainting?
No, I wouldn't say so.
And have you ever experienced any tremors?
No tremors.
Okay. And do you bruise easily?
No.
Especially during your exercise?
No, surprisingly, no. If I get like hit really hard, then maybe, but otherwise, pretty normal, nothing unusual.
Have you ever been diagnosed with anemia? And have you noticed like an increased appetite or heat and cold intolerance, that you can't tolerate the heat or the cold?
No, I'm pretty good with either heat and cold. I do very well with like cold temperatures regardless.
Have you noticed any excessive sweating?
No.
And these are some questions that I have to ask you, and it might be personal, but do you ever experience any anxiety or depression?
No.
If you're feeling sad, do you have a strong support system?
Yeah, my family's always there for me.
And how do you cope with sadness or stress or anxiety? If you
Just talking to my family and friends. Otherwise, just listening to some music, focusing on myself.
And have you had noticed any like memory problems?
Not that I'm remembering or aware of.
And thank you for answering all these questions to the best of your knowledge. I'm going to put in some lab work, and we'll follow up after we get a better results of your lab, since you haven't had any lab work done within the last 2 years, and we'll go from there. Okay?
Okay, sounds good. Thank you so much.
Thank you so much for your time.